today I'm going to tell you guys how to palpate the tibialis posterior tendon, the flexor digitorum longus tendon, the flexor hallucis longus tendon, the posterior tibial artery, the tibial nerve, and the tibialis anterior tendon. So starting with the tibialis posterior tendon, you're going to find the medial malleolus, and then you're going to ask your patient to plantar flex and invert their foot, so plant your toes and bring them inwards. And then you're going to be able to feel on the posterior aspect of the medial malleolus the tendon as it goes up and behind it. And if you came closer, you would see that right here. And then if you're not able to palpate it, you're going to resist this motion. So same motion, but I'm going to just resist you. And you'll be able to palpate it right here and all the way up. Okay, so flexor digitorum longus tendon. You're going to have them do the same thing. You're going to point your toes, come inwards, and it's going to be behind the tibialis posterior tendon. And then to be able to palpate, you're going to have them flex their toes and resist that motion. And it'll come out a little bit more, and you'll feel it more on the plantar surface of the foot, but it does come along this way. And then for the flexor hallucis longus, you're not able to palpate it unless they're having like symptoms relating to the flexor hallucis. Okay, next you have the posterior tibial artery, and that's going to be in between the flexor digitorum longus and flexor hallucis longus. So you're going to have them plantar flex and invert. And then on the posterior aspect of the medial malleolus, come over, and then you should be able to feel it right here. And then it goes up along here, and then down along the medial malleolus. And then for the tibial nerve, it's right behind the artery. It's kind of hard to palpate, but you won't be able to palpate it unless they're having symptoms. And then for the tibialis anterior tendon, you're going to have them dorsiflex their foot, and it'll be on the most medial side, and it'll come up this way and come down, and then you'll be able to feel the muscle belly on the lateral aspect of the tibia. And